everyone, greetings of the day. I'm Pooja from the Skin Wellbeing team, and I welcome all of you all to this show. I'm hoping all of you all are keeping in good health, and we all know that taking good care of our skin is so very essential. It is one of the largest organ, obviously, and the skin becomes the most essential aspect of your overall health. A fungal infection is very common on your skin and nails if you've ever experienced. Fungal infections or meiosis are diseases caused by a fungus, which is a yeast or a mold. Mild fungal infections can look like a rash and can be itchy or annoying. Let's connect today with a skin expert who can guide us more about fungal infections. Today, we have amongst us a very renowned skin expert, Dr. Anjali Ullas, who's live with us from Calicut. She's here to enlighten us on the topic of fungal infections. Dr. Anjali is MBBS, MD Cosmetology and Dermatology consultant. She is a cosmetology and dermatology specialist at the best dermatology hospital in Calicut, which is Aster MIMS. Dr. Anjali Ullas has also completed her MBBS from Acme Pariyaram Medical College and MD in cosmetology from Amala Institute of Medical Sciences. She has many years of experience in this field, and today we're completely delighted to have her amongst us to discuss more on the topic of fungal infection. Hello, doctor. Welcome to our show.
Hello, Pooja. Thank you so much.
So, doctor, we were talking about fungal infections. So, how do we really take care of fungal infections, and how do we even deal with them if we are experiencing one?
Okay, so fungal infections are like one of the most common cases that we see in our OPD, especially it's raining right here now. So almost daily we are seeing about 5 to 6 cases or up to 10 in few days. It's very rampant nowadays. So the first thing what I would like to highlight is if there is a lesion, which most of the people now understand, like what type of if it is a fungal infection or not, because it usually comes in the areas where there is occlusion and all the skin folds are like close to each other, like the axilla, like your beneath the breast, in your groin areas. So anytime you see a rash or redness and or you have itching in that area, come and meet a dermatologist as soon as possible. That is the first step which I would recommend everybody to do, because most of the people they go out there and do a self treatment by their own. They buy some creams, some things which might be wrong to use on these lesions, like which contains a steroid or something. So they use that and they come to us, and the infection really gets aggravated. By then, it starts spreading throughout the whole body, so then it becomes difficult for us to treat also. And then when you give the real treatment, it takes a longer duration also to, like heal. So as soon as you see any lesions which is present in your folds, please come and see your dermat doctor ASAP. So because the first lesion you see, you treat it properly, it goes off. Once it gets spread and it occurs all throughout your body, it's going to take a longer time, and the treatment is going to be difficult also. So this is the main thing which I would like to highlight about fungal infections.
Clearly, doctor. So, I've also heard that because fungal infections do not really come out as they are fungal, so people start having those home remedies and treatments. I remember personally using mustard oil when the first time I got to know that I've got a skin infection. So, I think if we can enlighten our viewers about what sort of treatment can be done if they're experiencing fungal infections.
Yeah, yeah, sure. So that's what. So treatment options are there a lot. I mean, there are both topical, that is the ointments and creams which you can apply. At the same time, oral medications. See, that's what I said. Like if you see a lesion initially, just a small one, so that we can actually treat it with just creams. Creams would be sufficient, and it will go off really fast. But most of the time, or majority of the cases, don't come with just one lesion. It will be there throughout, because by that time, as you mentioned, the patient would have already tried their own self remedies. They must have gone to the counter and applied their own creams and everything, and it would be already worsened by that time. So, in such scenarios, we will have to even give oral medications to the patient. So, there
Okay.
are beautiful treatment options available now. I mean, both topical, I mean, applications as well as oral medications. Like the topical, usually depending upon the fungus, because for everything we can't give just one. There are different topical medications. So depending upon the type of fungus, like you have heard about ringworm, that is
Yeah.
a very common, yeah, very common, thing which everybody knows. So for those kind of lesions, nowadays we usually give the, antifungals which are available in the market, very, very freely accessible, like luliconazole, miconazole, and all that. So you can give all those antifungals, but I told you if the lesions are widespread, we'll also have to give a lot, not lot, I mean like an oral medication also. So
Okay.
most commonly nowadays, like terbinafine and what to say, itraconazole, these are the ones which are the players of fungal infection
Yeah.
nowadays.
Yeah.
So yeah, but some cases can be challenging also, because once you start using the steroid creams and everything, there
Yes.
can be even a superficial bacterial infection. So that's what it can get worse also. It can go to that end stage also. So if there is a bacterial infection, you will have to give an antibacterial, like an antibiotic first, clear
Okay.
the bacterial infection, then give an antifungal. And the
Absolutely.
treatment, which I would like to say to all my patients, is within 2 weeks, you're going to get relief. If we give the right treatment, you're going to get relief in 2 weeks. But most of the patients stop right there. But that is
Yeah.
not what you're supposed to do. We tell the patients you have to take treatment at least for 2 months. Especially, I'm talking in the case of ringworm, okay, which is the
Okay.
most common one. 2 months. So applications has to be done, the medication we will give you for a duration which you have to take. So you shouldn't stop the treatment. So if you stop within 2 weeks, because by the time patient will get relief, so they stop. But if you
Yeah.
stop within 2 weeks, the thing comes back right after 2 months. So then it's
Absolutely.
going to be difficult. So that time when it comes back, we can't give you the same medicine which we gave you earlier. We will have to change. It is going to be more challenging. So if we take the right path initially itself, it's going to be very simple to treat, and it is nothing like a big serious infection or anything. Only thing is that we have to stick to the protocol, the guidelines, follow the doctor's orders, then it's all well.
Awesome. So, my viewers, I think this is a point for you. Please do not treat your fungal infection at home. It could be serious, it could be mild. Reach out to the doctor for the right set of medicines if required, or even for that matter, the topical application. So, doctor, you mentioned about the antibiotics per se. So, what sort of antibiotics do our viewers, need to really take when they go to the doctor, and is it really safe to have?
Yeah. So I per se would recommend the viewers to not take antibiotics by their own, because these are nowadays the antibiotic usage is so rampant that most of the drugs are basically being tolerant. The patients are not even responding to the basic antibiotics because they're eating it like paracetamol. Yeah. So
Yeah.
ideally, you should consult your dermat or your physician, whoever it is, and get the right prescription of the antibiotic, because there are so many antibiotics available in the market. You can't just select on your own and eat any
Absolutely.
antibiotic like that. So each type of infection has to be given a selective type of antibiotic. Like for example, if you're dealing with fungal infections and you have a superficial bacterial infection on it, then probably we'll have to give some skin friendly antibiotics like moxiclav or cefixime, all the cephalosporins, that group of antibiotics. But majority might go and take something which is easy to eat, like azithromycin, which needs just 1 day dosing for 5 days. But that's not going to work in this case. It
Okay.
will, but it will not do the complete benefit. So antibiotics ideally should be prescribed and taken from a doctor, and yeah, I mean
Okay.
taken it according to what he or she tells you to do.
Perfect. So antibiotics, again, doctors only, and of course, you have a different set of antibiotics for the kind of fungal infection you have. So, doctor, which is the serious form of fungal infection? Because there are a lot of these formats. So, if you could just highlight about that, please.
Yeah. So that's what I mentioned earlier. Like there is nothing like it's a damn serious condition or anything. If we treat it in the right way initially itself, we can get rid of it completely. There is
Okay.
no problem at all. But
Okay.
then, as I mentioned, if we go and do some treatments on your own, start applying steroid creams or some homemade remedies, it's going to worsen. And when this superficial bacterial infection comes on it, it becomes serious. Because when you have to treat the bacterial infection first, that has to settle. and then you have to treat your fungal infection also. So by then, what happens is the fungus starts going deeper into your skin. So that is what happens is when you start giving your antifungal treatment, you will have to give it for a very long time because this drug has to go all the way down and eradicate the fungus. So that's going to take a huge long of time. I mean, huge time. So in such scenarios, that is what. So if you have applied some topical steroids and or some other medications on your own, that is when your fungal infection is going to get serious. And then another type of fungal infection which is quite serious is your when it affects your head. That is called as tinea capitis. So if you see small patches of hair loss, like here, especially seen in small children, that is actually a serious infection because if you don't treat it early, you're going to lose hair in many places. So that kind of infections, if you see in children a very small patch of hair loss anywhere on the scalp, get it shown ASAP because such kind of lesions can be seen in several other conditions also. But most commonly, it could be a fungal infection. If you don't treat it early, all those areas are going to have lots of hair, and the hair follicles can even get destroyed. Another type of serious infection which I would consider in my practice is when it affects your nails. Because by the time patient comes to us with nail fungus, the nail is already gone. It is destroyed. Yeah. So then to get that nail back in the original form, it is going to be very difficult. So if you're going to see a small discoloration, like a yellowish or whitish discoloration on your nails, which I would advise everybody to inspect your nails at least once in a week regularly for any discolorations. To see any sort of discoloration like greenish, yellowish, or whitish, go and get consultation ASAP. That could be a fungal infection. So you have to prevent your nail from getting destroyed at the earliest.
Clearly, I'm looking at my nails as we speak. So please do look out for any of these signs, my viewers, to ensure that you get the right treatment at the right time. Doctor, another complaint that people usually face is that fungal infections are recurring. Why does it happen again and again and doesn't get completely knocked out of your body?
Yeah, so one of the most common reasons which I see in my OPDs, I tell the patient, okay, listen, you have to come to me after 2 weeks to see if the fungal infection has, settled. I will always call my patients after 2 weeks for a review after giving them the antifungal treatment. But
Yeah.
most of them don't turn up. Yeah, and so they stop it right there, and then again after 2 months, the fungus is going to come back. So you need at least 2 months. This is one of the most common cause of recurrence. So you need at least 2 months of treatment for the drug to penetrate deep into your skin, reach there, and then completely, remove the fungus. So treatment duration is very important, and every doctor, I mean, is supposed to tell the patient at this much time you have to take the medicine, come back to me, I have to see and leave you again for continuing the treatment. One of the most common cause. Secondly, patients with diabetes all have a weakened immune system always. So they would definitely have a higher chance of recurrence because their body is always having a high glucose state, which is a very favorable environment for the fungus to grow. So
Okay.
in such scenarios, we always see a recurrence in diabetic patients, patients who are obese. Okay, that is very important. One of the very important causes to prevent the recurrence of fungal infections. If your body weight is more, you have to definitely lose weight because your skin folds are going to be more in such scenarios. So those areas are always a good environment or harbor site for all the moisture, everything to stay there and again facilitate the fungal growth. So once you get a fungus and you treat it, if you're still obese, not losing weight, your skin folds are going to be there always, you're always going to get a fungal infection again. Okay. And then certain personal habits which I always see, like I tell my patients also, like if especially now it is monsoon time, you are supposed to most of the clothes are going to be put outside. The moisture is going to be there in that always. So you have to nicely iron. Like dry heat is the one which is going to destroy all the fungal spores which is present in the air and everything. So you have to
Yeah.
nicely iron your clothes, especially your undergarments, with dry heat, and then wear it so that the moisture everything is gone. Otherwise, with that moisture filled clothes you're going to wear on your body, and that again the environment gets created for the
Yeah.
fungus to grow, and that's another reason of recurrence. And if you're a person who is sweating, especially you're working out and everything, immediately after the workout, don't sit with those sweaty clothes and talk and chat and everything. Go and take bath ASAP. I mean,
Yeah.
as soon as possible, because that's again all the moisture, everything is again a harbor ground. So
Yeah.
go take bath fast, get all the sweat, everything washed off, wear clean, dry cotton clothes, loose fitting cotton clothes, especially for work, and then that will be very good for your skin. So these are some of the common causes that we see for recurrences, and we always tell all our patients to do all this.
Great. I think hygiene is really the way to go that we understand. Doctor, we do have some questions coming into our chat window. One is from Firoz, and he is asking specifically what are the symptoms of toenail fungus? Like we spoke about nail discoloration and stuff, but what are the symptoms of toenail fungus specifically?
Yeah. So toenail fungus is something that we see very commonly nowadays because most of the patients they ignore the slightest, like you can see initially I mentioned the slightest green or yellowish discoloration that we see. So what happens is that gets ignored. Okay, fine, let it be or leave it, yeah, we'll consult later, फिर करेंगे, like that. And then what happens is with time the fungus starts growing there, the discoloration starts spreading to the other, to more areas of the nail. Then what happens is it start involving your the lateral nail fold. There's a nail fold here. Okay, it starts involving there, and then the patient starts getting pain. That is one of another what to say symptom that we see because here swelling happens. Patient starts getting pain, so they keep asking what happened here, like what is the problem here. So this side starts swelling up. It gets red and swollen. Pain happens. Sometimes even from here, pus discharge comes out because the fungus has penetrated deep inside, it has infected the matrix, nail matrix, and inflammation has occurred there. This all happens in chronic long-term cases. Like you keep it like that it's without getting treated, it keeps happening. So, after that, what happens is the end stage. What happens is the nail gets destroyed, like the nail starts breaking off, you still keep ignoring it, you keep not taking the drug or anything, and you just keep ignoring the pain because after some time the pain, they might do some home remedies like salt compress or like put their leg in the salt water or something, so that time the swelling will slowly come down. But
Yeah.
again, if it gets ignored, the nail starts getting destroyed, it starts breaking off, the nail deformity happens, and that is the stage when patient comes. So by that time, even we'll be like, oh my God, the nail has already been destroyed. Like, where were you till now? Yeah.
Yeah.
So
Yeah.
actually, this,
Ignorance is clearly not the way we should be going ahead. Make sure you
yeah.
look out for the first signs. So, Feroz, we hope we answered your question there. Doctor, there's another question coming from Sheila Agarwal, and she is saying that can fungal infections really cause chills in our body? The
If there is,
chills.
yeah,
Yeah,
chills means, she means, I mean, I hope she means when we
the
have
winter
fever
chills. Yeah,
and all that.
yeah.
Yeah, so that's what. So if the fungal infection gets spread throughout the body, I've seen cases like this. Like there's basically no space on the body. It affects even the face, till the toes, everywhere there is fungal infection, completely ignored. And obviously, after application of steroids and everything, there is superficial bacterial infections on most of the lesions. In such cases, the patient can get fever, and associated with fever, there can be chills also. But it should be that widespread. Otherwise, with just few lesions here and there, it is usually not associated with any chills or anything. If it is that widespread, and in this scenario which I mentioned, it can, you can get.
Okay. So, hope Sheila, you got your answer related to fungal infections and chills. Doctor, another question from Pujashri is how do fungal infections affect dental health? Does it really do?
Dental health, yeah, because there can be a condition called as oral thrush or candidiasis. Okay, it will be
Okay.
seen as white patches inside your cheeks and over your lips and tongue and all that. So
Okay.
if your dental hygiene is not good, if you have a lot of dental caries, and in that scenario, you're basically having a focus of infection inside your mouth. So in such scenarios, you're more prone to develop other fungal infections like this oral thrush. And these patients, mostly the dental thing, the dental caries will be, because it will be there as a small black, you know, thing inside your mouth, which will not cause any problem in the initial stages. So when such a sort of infection is there in your mouth for a pretty long time, it is definitely a predisposing factor for development of a fungal infection called as oral thrush candidiasis, which is quite serious, and you have to get it treated ASAP immediately.
Okay, very well answered, doctor. Next question is coming from Deepak, and he says, "Is fungal infection really treated in the bloodstream? Does it
Uh,
really get into the bloodstream?"
no, see, no, it doesn't actually. No, it doesn't enter. Like the infections which I'm talking about, like the superficial ones, like that is our ringworm, jokic, and all. That is all restricted only to the skin. Okay, but
Okay.
there is a term called as there is another type of fungal infection called as deep fungal infection like
Okay.
aspergillosis, mucormycosis. There are some terms like that, that is serious ones. That is one which you have to get admitted and you have to be treated with IV antifungal and all. Okay. So those are the scenarios where you will have to take antifungals through the blood. Yeah. So that kind of fungus, which is deep fungal infections, can enter your bloodstream. And that is quite serious. It is actually admission and you will have to take IV antifungal. That is not just a simple, you will have so many other symptoms like fever, you will be debilitated, you will be, full of, you can't stand up or, it will be that kind of a scenario. So that is confirmed with the blood culture. We give the blood for culture. In that, fungal growth will be there. And so many other symptoms and signs are there, which by which we understand this is a deep fungal infection. We admit the patient and you will have to start taking IV antifungals. Yeah. So that is
Okay.
the place where the uh, the bloodstream gets infected with the fungus and you will have to take IV treatment.
Great. So thank you, Mr. Deepak, for asking that question about deep fungal infections in bloodstream. Doctor, another question that I had to ask you was, can a patient really stop taking treatment once they feel that the infection is subsided, they feel it's better? Imagine if the doctors prescribe the medication for 2 weeks or 3 weeks and they stop it after that. What really happens?
Yeah. So that is my common, the most common challenge which I'm facing because everybody stops within 2 weeks because by that time, if you give the fungal infection, the itching, everything reduces. They come to me also after correct 2 months. They'll be like, ma'am, I had 2 weeks last year. I mean, 2 months back again, but I did only 2 weeks, so now I'm coming again after 2 months. That's
Yeah.
it. So I tell them, don't stop. I had told you not to stop. See now what happened. The fun and it comes back. So and the thing is, it comes back in a much bigger way. Like
Yeah.
initially, they have just had 2 or 3 lesions on the body. When you get a recurrence, it is going to be much bigger.
Yeah.
By that time, the fungus outgrows your medications and all that because you have stopped early. So it even they undergo changes in your skin. Even they what is it multiply and they undergo changes. So they also come out of your medication, they get resistant to all that and they'll be like, okay, fine, let's grow again. And then they start growing much in a much bigger way. You get lesions in lot of other places and it's more challenging for us to treat also. So this is what happens if you basically stop treatment early. We tell patients to take, especially for ringworm and all that, minimum 2 months treatment. And if your nails are getting affected, because nail is a much thicker and harder structure, so for in the such scenarios where nail is affected for hand nails, we tell the patient minimum of 3 months treatment because the drug has to reach there, penetrate the nail and eradicate the fungus. It's going to take long time. You can't
Yeah.
expect them to go there fast and treat everything and finish it. No, it's a
Yeah.
drug, it's a medication. It takes time. And if it is toenail, you will have to do maybe for 3 to 4, more extended time, maybe 4 to 5 months. Because toenails are again more harder compared to your fingernails. So
Okay.
these scenarios, in these conditions, you will have to take a much longer treatment. 2 weeks and all is gonna do now.
Clearly. So, my viewers, please do ask your doctors. Don't decide that it's all treated. Let the doctor tell you when to stop. Till then, please continue so that the infection doesn't get worsened up. Doctor, another question, of course, for my pregnant ladies: can these antifungal drugs be consumed during pregnancy?
That's one of the challenges that we face actually, because during pregnancy we can't give everything, as we want to. So, which is pregnancy safe is actually which, if the patient has severe fungal infection, we try to control it with topical, that is with applications itself, like terbinafine, miconazole is all category B. So that we have certain categories to be followed, like it's a protocol. Like category B drugs can be given during pregnancy. It is okay, it is safe. Studies, it's study proven and research proven. That's how these categories are made. C, D, X, and all have to be completely avoided. The B drugs like terbinafine and miconazole is all safe during pregnancy. I try to control it with topicals itself maximum, but sometimes if it is so widespread that topical alone can't suffice, oral terbinafine. Terbinafine is a drug which we can give it during pregnancy. That it is a category B drug. Other than that, no other antifungal can be given. That is the thing. So, but most of the cases like respond to terbinafine when, I mean, pregnancy patients, they respond. So because of that, we are also a little bit relieved. I don't know what's going to happen later, because terbinafine it's also on the verge of getting extinct, because everybody is using it left and right. So as I told you, the fungus also starts growing. They start getting resistant to the drug. As of
Yeah.
now, things are okay. Yeah.
Okay. So, doctor, but what about having antifungals for long term? Like, I understand you said 2 months treatment and then we can stop, but there are some cases, and personally, my case as well, I've been put on antifungal for good 6 months, had to take a break. The fungal was back again, another 6 months of that drug. Imagine so much of long term drug abuse. Honestly, I was not comfortable. So, what really happens with a long term antifungal treatment?
Okay, so see, every drug, even paracetamol, which we take for headache or fever or anything, it has its own side effects. There's no drug in this whole planet that which doesn't have side effects. But
Yeah.
then, but then antifungals, like there is a certain duration which you have to give, like 3 to 4 months. If you're giving it for 3 to 4 months and all, it is all okay, because we have to monitor certain things in your blood, like your liver function test, and because that is the liver function test is going to be the main thing, because all these antifungals like which are taking oral is going to, by the metabolism happens through the liver. So the
Mm-hmm.
liver function tests are the ones which have to be monitored regularly, like on a monthly basis. So if those I mean your values of the liver function is like okay, like even if you take it for a 6 months time or anything, it is no problem. Only thing is that you have to monitor it for you have to monitor your liver tests for some time. And obviously like after like for 6 months later, still if you're having fungal infection, then we can actually improvise the regimen. Like instead of taking it on a daily basis, you can do something called as pulse dosing. So pulse dosing is like weekly, any weekly 2 days together, you can basically take the drug on a weekly basis. So that is called as pulse dosing. So that time what happens is the side effects or the damage, what it might do to the liver at a later stage all gets reduced. So there are certain regimens which you can modify, because some patients, like as you mentioned, might need an antifungal dosage for a pretty long time, maybe even
Yeah.
6 months more. So to reduce the side effects and to reduce the damage, whatever it might cause, we can modify or improvise the regimen. So in such scenarios, it will not do any problem. It will be all set.
Okay. So, doctor, another personal question. Beyond the antifungal medicines that we've been prescribed on, any changes that our nutrition should have, any changes in the home remedies that can really help in the fungal infection process?
Yeah. So nutrition, I would suggest, like, see, again, a precipitating or a predisposing factor is obesity, right? So in general, for our skin, hair, and nail health, like our lifestyle plays a very, very important role.
Yeah.
So ideally, I would suggest everybody, especially who is having recurrent fungal infections, like per se, there is no studies of nutrition related to fungal infection, but then in general, definitely all the nutritious food, like vegetables, fruit, protein, everything, and try to reduce all the high refined fat and like the sweets and everything to an extent. Okay, because especially if you're having overweight, then it would be definitely needed to cut off all that. You will have to start exercising and lose weight. And home remedies, it is better not to do any. Don't use maximum. What I would say is, if you're in the home, you want to reduce your itching, you just apply a moisturizer.
Okay.
Otherwise, like some people apply turmeric can come, by then the fungal infection would have been burned, and then the skin also gets burned, and it becomes whichever whatever redness was there, it becomes more red, and then patients start getting really frustrated and irritated. Similarly, anything else also, if you apply on the fungal infection on your own, it is only going to get worse, other than you giving the right antifungal drug or the ointment or the oral. So home remedies per se, I would say not to do anything. And
Okay.
the personal things is immediately. That's what, like immediately after you have a workout session, you are like sweating full time. It is
Yeah.
better that you remove the sweat ASAP. Like don't
Yeah.
keep it on a longer time. Another thing what you have to notice is, see if your family members are having, because you are having, it is a transmittable disease, you might
Yes.
spread it to many other people. So if
Yeah.
any of the family members are also having fungal infection, get them also treated, because you alone getting treatment is not going to work. If they are
Clearly.
also having fungal infection, this will again, the cycle will keep on coming inside outside, I mean, it just keeps on going out.
Clearly.
So you have to see if your family members, anybody is also having fungal infection, get them also treated. And
Okay.
don't, whoever is having fungal infection, don't share your items like your
Yeah.
towel or clothes or anything, because all this can get, spread from
Yeah.
one person to person. So always use everything separate. Clean and wash everything. Whoever is having fungal infection, wash it separately. And once you are treated, everybody else is also treated. Whoever is having, then it's fine to wash everything together. Ideally, as skin doctors, we say like not to share your, what to say, comb and towels and all. That would be in general a good hygienic measure. Like all sorts of even acne or fungal infections, all this kind of things can be prevented to an extent if you stop sharing your intimate items.
Clearly. So, transmissible is something that we need to be very careful of by not sharing our items. Personal hygiene has to be increased. So, my viewers, do take utmost care when you are having a fungal infection to ensure that you're keeping yourself away in terms of using each other's material and stuff. Dr. Nadal, probably the last question if we don't have anything in the chat window. Uh, what about ringworms that are happening in the feet area that people are usually experiencing? So, what and how should we really treat it?
Yeah, very good question. So we are seeing it commonly nowadays because now it is monsoon time here. So most of the people, like especially if you're working, having a office or corporate setup workup, you have to wear shoes, right? So most of the shoes are, like all this pointed, especially when you're working in office setup. It's going to be pointed and it is going to hold your feet all together closed like this from morning to evening. And on in the way of rain, some like water, everything would have already got inside your shoe and everything. You will not have time to wipe your feet, because you have to reach there on time and do your work. This is going to stay like this till evening. Yeah. So what happens is the moisture starts accumulating inside in between your toes, and now this is such a nice area for the fungus to grow. And like they start coming here, like in the interdigital spaces they start growing, like the redness comes, then you start itching, and then slowly the what say fungus starts expanding to the other area of the feet, and by then the patient will come to us. So that is the common thing that we often see. So I always tell my patients, like during the rainy time, like stop avoiding such, I mean stop wearing such close kind of footwear. Wear something open, and make sure that if water or something has fallen on your feet, wipe the interdigital spaces, keep them dry. If you, in case if there are scenarios where you can't avoid shoes, I have patients like that also. Such cases, we have absorbent powders, we have antifungal powders. You can put that in your shoes first. keep it out for some time, let it get, like the spread inside the shoes, then you wear it. So that is again a thing which helps to absorb all the moisture, keep your and helps to keep your interdigital spaces neat and dry. So that is one way by which we can actually prevent antifungal infections happening on the feet. Then another cause why fungal infections happen on your feet is when you have nail fungus. So you ignore the nail fungus grows nicely, it starts spreading into the adjacent space also. So if you don't treat this early, you will again start getting fungal infection on your feet. So that is another reason why fungal infections happen here. So all this is a cycle. So if you treat it at the earliest, like if it involves just one space, come and treat it ASAP. Otherwise, by then everything will all will get
Clearly, doctor. So I think everything boils down to hygiene, if I see, keeping things clean and dry, be it footwear, be it your skin, be it everything. So, yes, hygiene has to be like your top priority, my viewers. Even if you're doing everything, take that additional step to ensure that you don't catch a fungal infection. And if you do, then please do take appropriate measures to cure it as well. Doctor, we don't have any more questions from our viewers for now, and I think we've answered a lot of our questions as well coming up. This was clearly a very engaging and an interactive session. So I'd really like to thank you, Dr. Anjali, for your valuable time, and it has been a super informative session for our viewers and for me as well. We look forward for many more such sessions in coming times. And thank you very much, all our viewers, for staying tuned in and for your excellent participation. For more such information and updates on skin health and care, stay connected on our FB page, all about skin well being. We're also available on YouTube, Twitter, and Instagram. Thank you, and good day to all of you all.
Thank you so much. Thank